So do you want a case example?
Yeah, like you just said, you just started there by saying it was completely different working with Aaron.
Okay.
Why would you say it was completely different working with
Okay. So I worked with a woman who had a traditional care provider.
Yeah.
When she worked with them, she felt that she didn't need care and support, and she was very angry about the intrusion and tended to ask them to leave and didn't work with them. And then this had an impact on her family because it meant that her family had to try and support her, and emotionally they were really struggling, and practically.
Yeah.
So because we knew this wasn't working, then I was able to ask the in-house home care team to be involved, and I was amazed at how things changed so dramatically. Because when I went to see this woman, she even herself said to me that she felt the people who were coming in to see her really cared, and she looked forward to seeing them. And it took a while for her to accept more and more care, but it got to the point where she was kind of allowing, for want of a better word, allowing them to help her, which she'd never done before. But I think what also came out of it for me is she felt respected and heard, and like there was something genuine and not rushed. So my impression for the in-house team is that they can work with people who are more challenging, because if somebody doesn't want to do something, they can go back a bit later, which is a huge advantage and a dramatic change that no other agency can provide. I'm guessing that where service users are telling me that they feel valued and respected is because the staff do. So these staff are paid a salary and they get holiday pay, and their travel time is incorporated into their day. I don't know any other service that provides that, and I think for me as a social worker that's also really important, because I believe in addressing the inequalities affecting our whole country, and care workers should be respected and paid and valued for what they do.
In that lady's situation as well, I think, do you think sort of continuity of people coming into the house, into her home, understanding her?
Well, do you know what's interesting is there's still a number of different people who come in. So I don't quite know how it's managed, but the continuity-wise, it was no different to the traditional provider. However, there was something different about the attitude of the staff.
I think in the beginning it was very small, wasn't it? I think in the beginning we only sent 1 or 2 people to
So
build
you
that
started
relationship.
out.
I mean, ideally we would only send a team. That sometimes falls down because of sickness and stuff. But I think, like you say,
I think the particular provider before can actually provide continuity, but they can't provide the quality
so
that your team. So I do feel that there is definitely something about continuity, and I know that's a lot of our outcomes focus. From a mental health perspective, attitude, communication and skills is really important. And when we work with people with a more advanced dementia, who perhaps genuinely can't remember what happened half an hour ago, think about how important that means skills and approach and attitude is.
There you go, it's interesting, isn't it?
So I think that the in-house team have different training to external providers, that's apparent, which changes the whole way they speak to people. So you could have somebody from the in-house team who could meet somebody for the first time, and I think they will get so much further than someone who hasn't had their training, who's not paid a salary, who's not respected, not valued. So that value has got to come from the top to the frontline staff, and I think that's really important, particularly from a social work perspective.
Yeah, it's great.
I do think the hub teams also provide continuity because geographically they concentrate on a small area. So them and some of our external providers can provide continuity, but I think it's only the in-house team who give us staff who are paid a salary, respected and valued, who've had different training.